Welcome back to another episode of the Many Faces of Cancer podcast. I am your host, Melissa Grosboll, and joining me today is Tony Villiotti. And Tony is a native of Pittsburgh, Pennsylvania, and a graduate of Penn State University. He's a CPA and has spent his business career in various senior accounting and financial management positions. Tony has also served on the board of directors for two publicly traded companies. After retiring in 2003, Tony was diagnosed with nonalcoholic fatty liver disease. His disease progressed to NASH, which is nonalcoholic steatohepatitis, cirrhosis, and liver cancer, followed by a life-saving liver transplant in March of 2018. His experience with liver disease motivated him to form the Liver Education Advocates, a nonprofit corporation with the mission of increasing public awareness and providing education regarding non-alcoholic liver disease. Through LEA, Tony has developed educational materials he wishes he had when he was first diagnosed, and also produced a documentary intended to be a cautionary tale for those at risk or newly diagnosed with non-alcoholic fatty liver disease. So welcome to the show, Tony.
Thank you, Melissa.
It is so great to have you on. I really appreciate you taking the time to join me today.
Happy to do it.
Right. So we have a lot to talk about here. And I had a friend of yours, Beth Lehman, is the one who introduced us. And she talked a few months ago regarding liver disease and liver cancer due to alcoholism. And I'm really excited to have you on because we're hearing more and more about non-alcoholic fatty liver disease and cirrhosis. And I think there's a lot that's still misunderstood or just not known about it. So I really want to get into all of that. So can you kind of take me back to, when you were first diagnosed, what was going on in your life, and kind of the progression from there?
Yeah, sure. At the time I was first diagnosed with fatty liver, I was 59 years old. I'd actually been retired for 2 years. I also was a type 2 diabetic, and I was extremely overweight. I actually weighed 70 pounds more than I do right now. So the doctor had done some blood work, and he told me that my liver enzymes were elevated, and that indicated that I had a fatty liver. He didn't make a big deal of it, just he said I should lose some weight and that kind of thing. But I had heard that at every doctor's appointment, so it didn't really set off any warning bells that this was something I should be concerned about. So I walked out of that appointment not very concerned about my liver.
And did he not really make it be a big cause of concern? Just kind of lose some weight and that's it?
And we hear that a lot. The most common thing I hear is from the people we talk to is the doctor says you have a fatty liver, but it's not a big deal. And for most people, it's not. But the issue is that it can be. So at that point in time, I was seeing my doctor this is my primary care physician. I was seeing my primary care physician every 6 months because of my diabetes. So I continued going to him every 6 months. Sometimes he mentioned fatty liver, sometimes he didn't. Focus always on the diabetes.
So apparently it wasn't that big of a deal for him.
Exactly. And that just reinforced my mind. I mean, I never gave it a thought that this is something I should be concerned about. But 9 years later, in 2014, this is after 18 doctor's appointments, he told me I had NASH, which, as you mentioned, is non-alcoholic steatohepatitis, and probably has cirrhosis. I never heard of NASH. I didn't really know what to make of that. And cirrhosis, I always associated cirrhosis with alcohol or drug use. So my wife and I actually thought that he had called the wrong patient, that he had me mixed up with somebody else. But I found out that was not the case. Now, at this, through this point in time, over this 9 years, I had no symptoms. I felt fine. I had a little bit of fatigue, but I was getting older, and I just chalked that up to the aging process. So at that point, he referred me to a hepatologist, and she confirmed this cirrhosis diagnosis. And again, I still thought, I mean, it was something like I could live with. He was still experiencing no symptoms. Well,
Now, what is NASH? Like, I know that what it stands for, but what actually is NASH?
well, liver. What it is that the fat in your liver has increased, and the cells, your liver cells, have become have began to stiffen, and and it can impede the blood 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 through blood flow through your liver.
Gotcha. Okay. Which is not a good thing.
Not a good thing for sure. Yeah.
Right.
So again, I had the cirrhosis diagnosis. At that point in time, I began to see the hepatologist on a regular basis. And she would at that point I was doing MRI, getting MRIs periodically, and it was beginning to get a little worse, but still, I mean, I'm kind of a typical guy. I assume things are going to work out, and I don't need to worry about my health.
Did you start having symptoms at this point, or was
no,
you
still very, very, very minor. Yeah, just a fatigue, basically.
okay?
Well, before I had an MRI before an appointment in 2017. This is 2 years after I began to see the hepatologist, and I had an appointment scheduled, and I got a phone call that I should come in early for the appointment, which was not a good sign. She wanted to see me right away. So I walked into the appointment. At that point in time, she told me I had liver cancer, and I was still even being told I had liver cancer. I was still mostly concerned about my diabetes. That it was so deeply ingrained in my mind that I kept coming back to that. And I said, well, and she mentioned a transplant at that point in time. That's something I should really seriously think about. And I kind of said, well, do I really want to do that? Isn't that going to make my diabetes worse? And in kind of one sentence, she convinced me that I should be concerned. She said, we can treat you for diabetes. For diabetes, we cannot treat you if you're dead. So
Okay, well, that's
your message received. That's sunk in. So
now at this point, were you trying to lose weight at this point, or were you still just kind of doing what you were doing?
I had lost about 20 pounds. My weight, through the 9 years, my weight kind of yo-yoed like a lot of people. I'd be serious about it, and I'd lose some weight, and then I'd go off the wagon and indulge in too much Italian food, which is kind of my weakness, and the weight would go back up. So at that point, she suggested that we also bring an oncologist into the picture, and what he talked about with me was that if the cancer spread, or if the tumor became larger, that I would not be eligible for a transplant. So he recommended that I undergo a procedure called stereotactic body radiation therapy, which consists of 10 very targeted doses of 5 very targeted doses of radiation over a 10-day period.
Okay.
So I did that, and we began the process of getting me on the waiting list. Still very little in the way of symptoms. I got on the waiting list in June of 2017, and still, my life was just kind of going on as usual. Well, we wouldn't know for 6 months whether whether the SBRT procedure would worked. So, but over the summer, I did begin to experience symptoms. I was beginning to retain fluids in my abdomen and ultimately in my lungs. So I had to have my stomach drained. The first time that happened, I lost 20 pounds. That's how much fluid there was. And
wow.
I was beginning to experience loss of appetite. Fatigue was getting worse. And it was beginning to affect my life. In October was when things really reached their peak. And my wife came home one day, and I didn't know who she was.
Oh my goodness!
And I didn't know where it was. She described it it looked like I was trying to walk through a wall. I had my hands kind of on the wall. Looked like I was trying to push it out of the way. And she at that point, she thought I was dehydrated. So she was trying to feed me water, and I was saying I don't want that water. And she said I was acting like a 2-year-old while this was going on. I've no recollection of this. Although interestingly enough, she decided to film some of this on her phone, so I was able to see it afterwards. But anyway, she
And
called
you're like, that
911.
wasn't me. I don't remember
Exactly.
any of that.
Who's that guy? So she called 911, and they came and they took me to the hospital. I was admitted, and they told me I had hepatic encephalopathy, which meant that my liver had deteriorated to the point where it was not removing toxins from my bloodstream, and the ammonia had gotten into my bloodstream and gone to my brain, and my wife asked at the hospital. She said, "Well, what if I hadn't come home that soon?" She said, "Well, it would have been a lot worse, and actually, he could have been in a coma."
Oh my gosh!
So I stayed in the hospital for a week, and they worked to remove the ammonia from my blood system, and I was told again. I don't remember a whole lot of this, but I was not a very cooperative patient, and she has many stories. In fact, when I went back in the hospital later, everybody remembered me. So that was how bad I was. So
oh my gosh!
So that happened in, like I said, October, and I felt until that time I felt still I was experiencing symptoms. I still felt reasonably well, but from that point on, I had brain fog where I couldn't I really couldn't concentrate long enough to read a book, and it was interfering with my sleep, and just it was beginning to really place a burden on my wife, because she I'm usually kind of more of a laid back person, unless I'm watching a football game, but and all of a sudden I was this guy who had all these emotional ups and downs. Well, I actually had another episode of hepatic encephalopathy, which is much milder. Went to hospital for that, and I was out a couple of days later. Now, by this point in time, the 6 months from receiving the SBRT treatment had passed, and it had worked. A tumor had not grown and had not spread. So and at that point, I've been on a transplant waiting list for 6 months, and under the kind of the rules that were in effect at that time, if you have cancer and you're been on the waiting list for 6 months, you kind of get moved up the waiting list. So I was expecting I was going to get called any day. This was the middle of December. And my wife annually hosts a Christmas party for her family, and I told her, you should get your sister to host it this year because I'll be in the hospital with my transplant. Well, December came and went, January came and went, February came and went, and I, still no transplant. And my mental ups and downs were getting really bad. And just one day I would wake up and I was planning a vacation for after I got a transplant. The next day I'd wake up convinced I was never getting a transplant, and I started writing my obituary and letters to my kids. And obviously that was harder. I didn't really know much of what was going on, so much harder on my wife than it was on me.
Now, were you under any treatment at this time, or medication, or anything to help with the symptoms?
The only thing I was taking lactulose, which is the worst tasting drug I ever had in my life, but it works to absorb any ammonia that's in the blood system, and hopefully prevents additional cases of hepatic encephalopathy. But I wasn't I wasn't undergoing any treatments for the cancer. Okay. Now at that point in time, I'd read an article that um, that for heart transplant patients that they were starting to use livers that had been infected by hepatitis B, and were actually using those in a transplant. So I actually asked my doctor about whether that was since this weight was taken forever, I inquired whether that was a possibility. And after, I mean, they'd never done one. So at the hospital I was going to, so they had to run it up the flagpole and discuss the ethics of it and so forth. But so
It
I was
doesn't
all
sound
set to
very
take that.
ethical.
Yeah. But it turned out that kind of right after that, I kind of reached the 9-month mark of being on the transplant list, and a liver did become available. So I was transplanted on March 18th of 2018, about 7.5 years ago. Kind of ironically, I, all along I said the day I do not want to get called for the transplant is St. Patrick's Day, March 17th. My father had passed away on St. Patrick's Day, and I was diagnosed with cancer on St. Patrick's Day.
Oh my goodness.
So it didn't seem like a very good luck day. Well, sure enough, that's the day I got the call. And it made my mind rest a little easier, though. They didn't actually do the transplant until the next day.
Okay.
But I went home, after 8 days, I went home, and things have, that I've had no liver issues since then. The brain, after a month or two, the brain fog dissipated, and I was, kind of back, after I regained my strength, I was kind of back to my normal self.
Wow. That's such an amazing story. Now I kind of have a couple questions based on all of that. So, it said it was like 9 years before, your doctor even said anything about other issues. Now, I don't want to say negligence on your doctor's standpoint, but were there signs or something that, like, if it had been caught earlier, you might not have gone down this road?
Well,
Or is this something that you think about, you talk about, but you don't know for sure?
yeah. Well, I'm convinced if I had known earlier that I was at risk for cirrhosis, I would never have had a transplant, because I would have taken this very seriously, and my wife would have maintained a strict control over my diet. So that's why early detection is of the disease is just so important. I mean, now at the time when I was going through this, there weren't as many diagnostic tools as there are now. There are non-invasive tests that can be done that identifies it earlier. And I always told people, if I'd been given a roadmap on day one, I was told I had a fatty liver, I wouldn't be sitting here today. I wouldn't I would never have had a transplant or had liver cancer. So and actually, when about 6 months after my transplant, because of my experience, there are two things that jumped out at me. One was how few people knew about non-alcoholic liver disease, and second, how little education was given to patients about the disease. So that's when my wife and I decided to found our nonprofit, and with the name of increasing awareness and providing education. And actually, the first thing we did was we developed the Fatty Liver Roadmap. That's still a very popular item. When we go out, to events and so forth, we bring those with us, and it's very well received. We also produced a documentary about my experience that was shown on PBS here in Pittsburgh and also in Maryland. So
Wow.
it was obviously a life altering experience for me.
Well, and this is really, I guess, a cautionary tale, like you said in the beginning, but about type 2 diabetes. I talk about being a personal trainer. I talk to my clients who come in after cancer treatments and things, and especially female cancers or reproductive cancers that put you into menopause and put you at greater risk for obesity and diabetes. But diabetes is also very much a risk factor and a precursor to several cancers. And so, I don't even know the statistics now. I'm sure you do,
Yeah,
about how many people in our country right now have type 2 diabetes.
yeah,
And it's not just about being overweight and not being able to manage your glucose. There's so many other things that it is a risk factor for. So does your organization really try and target, people with diabetes as well, to get them to make some changes before it goes down this road?
uh, yes, we do, because as many as 80% of people with type 2 diabetes also have a fatty liver. So,
Wow.
so it is a major risk factor, along with obesity, for fatty liver disease. So we do have educational materials, about that, um, and that's another. We do a lot of one-page infographics, just
Okay.
intended to educate people, and we have a couple of those, regarding diabetes. So yeah, that's definitely something that we're concerned about, and we try to educate people about. And the other thing, this is consistent with both diabetes and fatty liver. You do not need to be overweight, to get either of the diseases.
True.
There is a tendency to associate both fatty liver disease and diabetes with being overweight, and you can be thin as a rail and still be affected by both diseases.
And I kind of call it skinny fat.
Yeah,
Just because you're not overweight doesn't
yeah,
mean that you're healthy.
yeah, and that's they sometimes that refers to as TOFI, referred to as TOFI, thin on the outside, fat on the inside.
That's true. And I mean, diabetes is a lifestyle disease. I
Yes.
mean, it will progress to the point where it's no longer that, but it can very much be controlled and even reversed if caught early, or just not getting it all with lifestyle changes, the way you eat, the way you move, all of that. And this is just, it's a 20th century disease that's all based around the crap that we're putting in our bodies
Yeah.
now.
Exactly. Yeah. I mean, I had terrible eating habits. I mean, in addition to my love of Italian food, I mean, I would eat lots of fast food. In fact, at my worst, I would stop on the way in and work in the morning. I would stop to get a milkshake and a breakfast sandwich. And so,
Well,
that
there's
obviously,
your milk, right? Your milk
yeah,
with your
exactly, yeah.
breakfast. It's just frozen. No big
and,
deal.
and I never gave it a second thought. I mean, I knew I was overweight, obviously, but actually, my blood pressure was pretty much under control, and the diabetes really wasn't so bad. Um, I before the transplant, I had was while I was I was using medication for diabetes. I was taking metformin.
Mhm.
I you know was not taking any insulin shots. Now since the transplant, the diabetes did get worse. Uh, that's why I tell people, the transplant is not a get out of jail free card. It's the end of a chapter, but there's another chapter coming, and I now take as many as 4 insulin shots a day because of my diabetes. In the drugs that the anti-rejection drugs I take because of the transplant have also affected my kidneys. I had normal kidneys before the transplant. I've lost more than half my kidney function, and which actually honestly does not affect my daily life, but I know it's kind of out there hanging over me.
Now, is that a general side effect of anti-rejection drugs?
Yeah, it happens a lot. Yes.
Okay. All right. Just, I mean, because the kidneys have to filter all of that, and
Yeah.
it can cause damage,
And
in the
the
filtering
medication. I
process.
mean, all these medications have side effects,
Right.
and some of the anti-rejection drugs are hard on the kidneys.
Okay. Well, yeah. I mean, most drugs are
Yeah.
hard on the kidneys, unfortunately.
Right.
Um, and then, so was your donor a living donor, or do you have information on your donor?
No, it was a deceased donor.
Okay.
That's why a living donor is a much easier way to go because you kind of know what's going to happen. I I mean, I described, waiting for the liver as being pregnant without a due date. And ironically, I received my, I got delivered 9 months after I got on a waiting list. Kind of
All right, that's a
ironic.
pretty good analogy there.
But it was a deceased donor, and I got, you get a phone call that there's a liver available, and it turned out to be a high risk liver. As it turned out, the donor lived with a drug user, so that resulted in his liver being characterized as high risk, and the liver was actually turned down by another hospital system, but I said I'll take it, and the doctor, the doctor looked at it, who's going to be doing a transplant, and said, no, it's not that. This liver's okay. And he says it's not a Cadillac, but it's a good Chevy or Ford. So it was the deceased donor, and we did reach out to his family, through a different nonprofit organization who does that kind of thing, and we sent them a letter. We didn't hear back initially, but about a year after, we sent a letter. I did get a letter back from the fellow's daughter, just saying, she apologized for taking so long to respond, but said that she had a hard time dealing with her dad's death, and that he was the kind of person who liked to help people while he was alive, and she's glad that he was still doing good after his death.
I love to hear that. And then the other thing I wanted to ask, based on your story, so does fatty liver disease, is there, I mean, I know there's a correlation between fatty liver disease and cancer. Do you have any kind of statistics as to how often one progresses to the other, or is it just kind of sometimes here, sometimes not?
There are percentages. It is kind of random. Like, you don't know. I mean, I didn't. They did not tell me that cirrhosis was going to happen or liver cancer is going to happen. And the statistics are that about 25% of the people with NASH will progress to cirrhosis, and from there, I think 15 to 20% of the people with cirrhosis will project the cancer, will progress to cancer. Now, okay. You can get the cancer without having cirrhosis, so it's not,
of course,
it's not a necessary,
right. I just didn't know how much of a correlation there was between the two.
But there is. I mean, it's one of those things. I mean, there's like a 25% chance of fatty liver progressing to non-alcoholic steatohepatitis, a 25% chance of that progressing to NASH, a 25% chance of that progressing to cirrhosis, and then the 15 to 20% to cirrhosis. So when you look at the percentages, it was kind of very remote that I was going to end up with cancer, but but lucky me, I defied the odds.
Now, is there, I mean, other than obviously the triggering factor, is there a big difference between alcoholic fatty liver, alcoholic cirrhosis, and non-alcoholic as far as symptomatology, as far as progression, prognosis, those things?
Well, once it progresses to cirrhosis, I don't think there is any difference.
Cirrhosis is cirrhosis regardless of the cause.
I would say the biggest difference is oftentimes the alcoholism is caught. I mean, I think people, in general, people know that alcoholism or heavy alcohol use, does affect the liver and can progress to cirrhosis. Where for a non-alcoholic, you're kind of going along, eating your way through life without realizing that you're putting yourself at risk. So I would say that's the principal difference. But at the end of the day, I mean, as I said, cirrhosis is cirrhosis, and liver cancer is liver cancer.
Right. And now, are there things that, and I'm sure your organization, does a lot of this. Are there early symptoms that you can look out for? Are there screening procedures? Anything that can kind of help before it gets to this point? Because you said you really didn't have any symptoms. you were just going in for your diabetes, I mean, are there screening procedures or anything
Yeah.
that people can look out for early
Yes.
detection?
Yes, sir. Because one of the questions that we often got, when we go out, we do a lot of public events where we go out and just talk to the general public, just trying to make them aware of this. So one of the questions we often get is, how do I know I'm at risk? And so we have a postcard we give people, and there are several risk factors. Type 2 diabetes, if you're if your BMI is greater than 30, if you have high blood pressure, if you have cardiac issues, if you have any two of those, if you have any of them, you're at risk. If you have any two, you're highly at risk. So what we tell people is, okay, this will tell you in a 30-second discussion. I can tell you if you're at risk, um, and what we do then is there's a test that's called the FIB-4, which is a test based on blood markers and in your age that produces an index that tells you how what level of risk you have.
Okay.
It's not a perfect test, but it's a good test. So that's what we recommend is that talk to your doctor. I mean, you can calculate if you have your the blood markers, if you're doing that anyway in your course of your annual physical and so forth, you can actually do the calculation yourself, or ask tell your doctor you want him to calculate it, and he'll prescribe the blood test that you need to take, and then that index will tell you what your level of risk is, and then if you're at high risk at that point, you need to get some additional screening. There are there's something called a FibroScan, and there are several tests like that are similar. So the idea is you either do one of those, which will further define your level of risk, or there's an additional blood test called the ELF test, enhanced liver fibrosis test, that can be done. The issue is that the FIB-4 can be done at the primary care physician level. The other tests have to be done at the specialist level. Now a lot of the protocols laid out by the American Diabetes Association are that that all diabetics should be screened for fatty liver, through the through an ultrasound, one of the ultrasound tests. So there are ways, there are stops along the way. The big step in our mind is just educate people about what the risk factors are, and if once they know that, I mean, obviously some people will just ignore it, but if you know that and you're concerned about your health, you can we try to guide you through the next steps without giving. I mean, we're not doctors, so we don't give medical advice, but we say, well, we tell people, talk to your doctor and get these tests done.
Now, are basic liver functions done at your annual physical when you get your blood work done for your annual physical? Is there something in that, or is it a special test that you need to ask for?
Well, there's a liver function panel, and to be honest, I don't think it's actually always done as normally. I mean, if your doctor, my doctor, give him credit for one thing. He knew enough to have me do the liver function panel, so he knew I was at risk. So, but it's something you often have to ask for. So it's not really a part of your normal. And it's, liver is kind of, I'm an old guy, so I think of it. Liver is kind of the Rodney Dangerfield of the of the organs. It gets no respect. So most physicians will not discuss your liver with you unless you raise it. So that's what we advise people. If you're at risk, be sure to talk to your doctor about it. Make sure he knows that you're concerned about it.
And hopefully, if you have diabetes, then you're getting these tests done as part of
that should be. And often more and more diabetes doctors have these ultrasound machines in their office. It used to be nobody did. It just you had to go to a hepatologist, and they're still depending where you live, they can still be difficult to access one of those machines. I know we know people who are 3 hours away from their their hepatologist, so it's not really very accessible. That's why I think the blood work, and anything that can be done through blood markers is good, because they can be done at the primary care level, and it's just much more easily accessible.
Okay. All right. Well, tell us a little bit about your documentary. This is awesome. And is it like available somewhere where people can view it?
Yeah. The documentary is available on my website. On our website, and there's a link actually to a YouTube channel where you can access the documentary. But we decided
we'll put that in the show notes too.
So after my experience, when we decided to start the nonprofit, we thought it would be a great thing if we just took our cell phones and recorded each other talking about what we had just been through, both from a patient standpoint and from a caregiver standpoint.
Okay.
So we're thinking about that, and then it just so happens that a member of our church is a video producer. So we contacted him and said, well, maybe this would be something that should be done more formally, and turn it into a documentary. So we contacted this fella, and he thought it was a great idea for a documentary. Then he told us how much it was going to cost, and that suddenly became an issue. But you always have these angels at the end of your life. Or the widow of my best childhood friend was having dinner with my wife, and my wife was telling her about the documentary, and she said, "Well, I have a IRA I had when I was single. I think Jim would like you to have it." So she wrote us a check for $40,000.
Wow!
And so we went back. We went back to the video producer and said, "Well, this is what we have to spend." So we kind of scaled back. It went from an hour documentary to a half hour, and we changed the producer and so forth. So we did that. So we worked with the producer to write the script, and it tells my story, but also the story of a couple other people. One of which was a relative who died from liver disease because it was not diagnosed early enough. So it is 27 minutes long, and like I said, it tells the story of 3 people. We have a few doctors in there as well, talking, giving their perspective on the disease. This is available on our website.
I love that. All right, and what is your website? And we'll put it in the notes, but
liveradvocates.org.
Okay.
liveradvocates.org.
And I'm assuming most of your outreach and stuff and events and stuff that you go through is in the Pittsburgh area.
Well, actually, we've participated in events in about 10 different states this year.
Okay, great.
We actually now have a team member in the Los Angeles area, because one of the things we do, the Hispanic community is more at risk than other ethnicities. So we do a lot of work with the Hispanic community. And Pittsburgh is not exactly the center of Hispanic population.
True.
So we thought we really, if we were going to do this, we should have somebody out in California who can work with groups out there. So we've been doing work with the Mexican consulates across the country. We've had events that we participate in New York, New Jersey, Georgia, Ohio, West Virginia, in California, so in Minnesota. So I started keeping track. We actually have an ambassador program where we encourage people who are who have kind of been through or are going through the disease progression, and who want to help out in their community, we kind of enlist them as ambassadors, and we give them the tools to do it in their own community. Most of those, we also have a support group that actually my wife runs for liver patients and caregivers, and a lot of the ambassadors really come from that, where they become familiar with what we're doing and say, hey, I'd like to do this too, but I don't want to form my own nonprofit, so how can I help? So we try to do it. I mean, most of the stuff we do is in Pittsburgh, but not everything.
Okay. And then if people want to get involved with that, they can just get that information on your website as well?
Yeah, if they visit the website and just contact us, and we can we'll connect and see what we can do.
Okay. So liveradvocates.org is the one-stop shop for all the things.
Yes, that's correct. All of our materials are there, documentaries there, and and a lot of other materials.
Awesome. All right. Well, one last thing, Tony, before I let you go. So I asked this of all of my guests, and it's like, if you were to come across somebody who was just diagnosed, and I usually say this about cancer, but even like just diagnosed with fatty liver disease, cirrhosis, any of the things, and are in just a total state of overwhelm about their diagnosis, like what is one piece of advice that you would give to somebody kind of just starting on this journey?
Yeah, the first step, I mean, if you're already aware, I mean, the first step we give to anybody is, become aware of the risk factors. If you're past that point where you have a diagnosis, the biggest thing you can do is to lose 5 to 10% of your body weight, and also work on your diet. Cut out added sugar. Reduce your carbohydrates, particularly the processed or the refined carbohydrates, and just in general, just work on your diet, and because that's, I mean, it really is a lifestyle disease, and if you can change your lifestyle, you can change the course of the disease.
Perfect. Awesome. Well, thank you so much for your time today. This is great information, and yes, this is a show about cancer, but diabetes and fatty liver are definitely risk factors, and they can also be side effects and after effects of a cancer diagnosis. So I really appreciate all the information today, and congratulations on 7 years out from a transplant, and still kicking and doing so much good for so many people out there.
Yeah, thank you very much. Thank you very much. And I appreciate the invitation to be on the show.
All right. Have a great rest of your day.
Thank you.
Bye-bye.